Welcome to the Salmon Runs YouTube. Enjoy the video.
You start by assessing current vision and creating a clear baseline. This tells you what to improve. Use a Snellen chart or trusted app, note numbers and symptoms, and make sure you have your current prescription and clean lenses. Once done, perform a short blink-in trace test to check ocular motility, then schedule a professional eye exam within 1-2 weeks. You do these first steps because accurate data prevents wasted effort and flags urgent problems early. You implement the clinician's plan precisely. Medications and drops must follow timing and dosage to be effective. If prescribed vision therapy, perform exercises for 10-15 minutes, 2 to 3 times daily. Consistency retrains focus and coordination. Make lifestyle adjustments, manage blood sugar, reduce continuous screen exposure, and apply the 20-20-20 rule to decrease strain. Once therapy and habits align, reevaluate progress at scheduled follow-ups, so adjustments can be made promptly for measurable improvement. You now consolidate gains by tracking progress and maintaining protective habits. Keep weekly logs and repeat the same vision test to compare objectively. Maintain protective measures. UV sunglasses, lubricating drops as needed, and routine exams every 6 to 12 months so minor declines are caught early. If improvement stalls, revisit your provider and adjust therapy. And if you experience sudden worsening, pain, flashes, or field loss, seek emergency.
Thanks for watching. Consider subscribing if we helped you.